Hi, I'm Rebecca Martinez Fitzgerald. I'm an LCSWA practicing EFT in North Carolina, and this is part of a series of interviews I am doing with EFT practitioners in North and South Carolina for the Carolina Center for EFT. Today, I'm talking with Dr. Mary HInson. Hi,
Hello.
Mary, will you tell us about yourself?
Absolutely. So thank you for having me.
Mm,
My name is Mary HInson. I am a clinical mental health counselor supervisor in the state of North Carolina. My PhD is in counselor education and supervision. So most of my background has to do with community mental health. I'm also a contractor with the DoD as a military family life counselor. So I work a lot with military community. So very transient area that I'm in. I have been with the EFT community for 2 years, going on 3 years actually, and have been practicing the model since then, but have been practicing counseling 15 years
mm,
at this point. So I am based out of Fayetteville, Fort Bragg area, where everybody is 2 degrees separated from someone on the military base. And the population that I primarily work with is military couples and individuals, along with youth of military families as well. So I enjoy it. I really love talking about this topic, presenting on this topic, supporting other clinicians with what I'm aware of and know to share with them too.
awesome. All couples have hard times and deal with attachment injuries. What are specific challenges and considerations for military couples?
Sure. So, military couples are unique, meaning we cannot treat them the same way as a civilian couple and expect the same outcome. That's kind of tough as a clinician because you're thinking, well, you're a couple and that's all that matters. But it's more than that. Um, some of the things that we do have to consider is there's a lot of stop and start with couples because with military couples because of going TDY, or they have to go to school to get trained in something with their MOS perhaps, or deployments. And deployments can be short-term deployments or long-term deployments. Sometimes you can bring your family, sometimes you can't. Sometimes you're in areas that you cannot communicate regularly, and sometimes you are. And so those things on any couple certainly would be impactful. The other thing that we have to consider is that there's dual military couples. So this means each partner is a part of the military community and they have their own requirements. With that, it also impacts moves, if they can move together or not, and then childcare plans as well. So those are some differences, some big differences with military couples. The other part is like work schedule and labor. Totally not 9 to 5-ish or 8 to 5-ish. Sometimes you stay until you're done. And that can be disappointing for the other partner sometimes when they're waiting for you at dinner at 6 and you're not there and you couldn't even have your phone in the building to call your partner about it either. And so those are some differences that
Yeah,
happen. Mhm.
that makes a ton of sense. There's so many obligations in addition to just daily work life or
Right,
family stress or whatever that are often outside of the control of the individuals in this
right,
partnership.
right,
So,
exactly.
yeah. So when you are doing EFT work with military couples, how do you approach that?
So I do a lot of education on the front end when we talk about attachment injuries or just cycles. I try to stay away from any type of jargon aside from the word attachment injury. Um, like pursuer, withdrawer. I don't use those terms specifically with them in the beginning either. And then we also do a lot of work with normalizing that they're
Mm.
here. Some service members are fixers and they're like, just tell me what I need to do, right, to fix it.
Yes. Tell me
But
what
it's
to do. I'll do better. But you get past all of it.
exactly, exactly. And so there's a difference there. And then under appreciation for military spouses
Mm.
happens because it's really hard sometimes for their career to flourish or for them to get invested because then they have to move. And so that might mean that they're dependent on their partner financially, but that doesn't negate their role in the relationship. And so highlighting that sometimes for service members, even to know, yes, you are the breadwinner here, but as far as the relationship, you're 50% of that. And so that part is important to highlight, just like dynamics there. The other thing that I have to be cognizant of in working with military couples is scheduling. Sometimes they have to cancel and cannot give you a 24-hour notice because command team needs to meet with them today, and that's it. So the idea that they communicate about, hey, I'm going to have to reschedule, or I have one of my soldiers, need some help that I'm in charge of. I have to be flexible with that and not guilt them for that kind of thing. And so that's a different approach too, with a lot of civilian versus civilian couples that I work with.
Yeah. Okay, that makes a lot of sense. So I know that many of your military couples are Black or have a partner in the couple who is Black. How do you approach work with these couples, whether they're interracial or have
Mhm.
Black partners?
Sure. So in the military community, there are a lot of interracial couples. So just imagine people traveling around the world and then they get the emoji heart eyes and it happens. Or some, it's a very short dating period because they want to get married before PCS or before they deploy. And so how the couples come to pair or form can be different. And sometimes it results in an interracial couple, even more now, same sex couples. I'm seeing a few more of those as well. And so couples in which one partner is of color or both are of color, it's a extra layer essentially that we have to be mindful of. Um, when you wear the uniform, it's kind of like a one size fits all, like from the outside, like everyone's a soldier and that's kind of it. But if we think about some of the events from the last year, 2 years that have heightened, um, sentiments that individuals have, someone who's in the uniform, there's not going to be a lot of, let me express myself, this isn't right. Like there's not going to be a lot of that. Um, and I work with special forces side, and the majority are not of color. So for one to be of color, um, I'm already dealing with someone who may feel isolated in some senses. And so to bring them aboard, or if they are part of a relationship where it's an interracial dynamic, bringing it up is important to show that I'm not afraid to lean in there for those couples. And if it's a couple where both individuals are of color, highlighting what that looks like and what that is like for them. One of the things I really like to use is Dr. Paul Guillory's attachment interview, and it has a focus on individuals of color. And when I use that, I'm able to get a clearer picture as to what their history was. So he has questions in there such as, who took care of you when you were sick or emotionally? And to hear some of the stories of service members and who that person is, or the absence of someone there, can be really telling. And then the message that you got about being a Black man or a Black woman, um, what that means can also be something that lends itself to more exploration. So with these couples, it's like an extra step or extra consideration that we have to be mindful of, especially given that they are service members.
Mhm. So before we go, what do you want other EFT practitioners to know about working either with military couples and couples of color and or military couples of color?
Don't be afraid to ask questions about certain things like jargon that they use or acronyms that you may not be aware of. You can ask what it means, and that's okay. It doesn't mean you're any less competent in working with them. Don't be surprised that they're calling you ma'am, sir all the time, because that is just what they're used to. Or even time, if they say, "Yep, I can meet at 1400." There's some differences there. Or if you ask, "How would you like for me to address you as?" They may say their last name,
Mm,
or right. And so asking them, about, well, what is your first name, or what name would you prefer? I think can really kind of set the tone or energy there. Um, Do acknowledge some of the differences as far as treatment, even in the military, for individuals of color,
Mhm.
and then what happens for them after they take the uniform off or on the drive home. Like, what type of mechanisms or support people do they have or can enact in order to kind of decompress from that day, from the day of microaggressions, or feeling like you were overseen for, promotion or rank or things of that nature, jobs. And so asking what those supports look like. The last thing I would note is, don't be surprised about the hesitancy to reveal much. And the reason I'm highlighting that is because there is a stigma of mental health in the military community, with the thoughts of this will go back to my command team, or that I can get kicked out of the military, especially if was an issue of cheating or infidelity or something of that nature. And so they are on alert for those things, or mindful of those things, because for them it can translate into a reduction in pay or reduction in rank. So there's larger consequences for them.
Lots of things at stake
Yeah,
beyond just
yeah.
the quality of their connection.
Exactly, exactly. So we have to be mindful of what this may look like for them, and then for them to be a person of color. If you say, "Hey, I understand I'm from a privileged position. I just want you to know it's okay for us to talk about you being of color." Uh, don't expect the, "Oh, great, let me just pour out my heart." Like, it's
Woo.
not going to happen like that. Just bits and pieces, and just continue to give the invitation, but not to expect a, like, "Oh, you're the savior for me, I'll just tell you everything,"
Right.
because that is not how they're trained. The idea is to keep it in, suppress, show up for the mission first. That is the way that they are trained. And so when I talk about successes, I'll say, so in your relationship, the mission is for more peace in the home, or
Mhm.
the mission is for you guys to be able to create this environment that's comfortable. I may use more lingo like
Yeah.
that,
Okay.
to kind of focus them, but do know that's kind of like the environment that they're expected to do well in order to keep their job or to be successful. So we have to figure out ways that translates over to civilian side, because they have to go back and forth, which lends itself to code switching.
That makes a ton of sense. Dr. Mary Hinson, thank you so much for your time. I really appreciate it.
Absolutely. Thanks for having me.
Yeah. Take care. Thanks.
You too.
Bye.
Bye.